My name is Stephanie Blank, and I'm the Director of Gynecologic Oncology for the Mount Sinai Health System. I've been a gynecologic oncologist for 20 years, so I can't believe it, but I've met a lot of women that are newly diagnosed, or people that are newly diagnosed with gynecologic cancers. And I have some thoughts about that, and I was really honored to be asked to speak here, so thank you for coming. I appreciate it. And as Rachel or Jillian said, newly diagnosed can mean a lot of different things, but I'm going to start at very newly diagnosed. So when you hear you have, a new diagnosis of cancer or a suspicion of cancer, I think after you hear that little bit of information, it's very hard to hear anything else. So I think, people feel very rush at the very beginning when they get the diagnosis, and they need to know, there's so many things to do, so many tests to have done, so many people to talk to. I think the first thing I like to tell people is that you should just stop for a minute and take a breath, because there's almost never an emergency, and you just have to stop and breathe and just check in with yourself, because you can do this, you can take care of it, and you just have a lot of things you need to do. I think the thing that's overwhelming is the amount of information, and I think sometimes actually, I generally recommend that people bring someone with them to appointments. Now, it's a little hard to do that these days with COVID, although in our center, for example, new patients can bring somebody with them. But even if you can't bring someone with you for appointments, to have somebody just easily available on the phone, someone else to take notes, somebody else to just make sure you heard correctly, is a really good idea. Now, if you're not comfortable with somebody else having your information, so be it. That's your own choice. But I think if there is somebody else that you feel comfortable with hearing the information that you're getting, I strongly recommend bringing that person with you. Now, in terms of information, I think the other thing is, it's not only one time that you're going to get information. So if you get your new diagnosis and you're completely overwhelmed and can't hear anything else, you can just say, I'm a little overwhelmed right now. Can I come back next week and have another discussion? I think one of the main things I'd want to say is, it's all about you. You're the person going through this. It's all about you getting the care that you need. So you do not have to worry about anyone else in terms of your medical care team. You have to make sure that you're comfortable with it. If you're with somebody, you can ask 2 questions. You can ask more questions. Just make sure you understand what's being said. And if you don't, you might need to schedule another time to talk, because you need time. This can't be delivered to you in a rushed fashion. And clinics are often somewhat rushed. Let's say you're going for an appointment. I also do recommend that you maybe keep a list of questions, because you will not remember everything that you want to ask. So I think that's a very good idea. Now, you have a new diagnosis. The first thing you need to know is it correct? If it's based on pathology or radiology, you may want another person to look at those slides or look at those films. If you're going to 2 different institutions, you should have both institutions look at your slides. There are different levels of pathologists. There are some that are in the community, and there are some at academic centers. Obviously, I work at an academic center. I'm a little biased, but I would think that you would want your pathology reviewed at an academic center by a gynecologic trained pathologist. That's something. Yeah. So when you meet your doctor, you should feel comfortable. And so it's very important you have a good relationship with your doctor, one where you feel that you can speak and such, because it's not just a surgery. I mean, people just say, I don't care about that person's personality because that person's a great surgeon, but it's more than just the surgery. So I think that you really need to make sure that you're comfortable. And if you're not comfortable, you do not have to stay there. You do not have to worry about hurting anybody's feelings. That's what I was trying to say before, not so correctly. Second opinions are totally fine. I think we all expect it in the field. That's not to say you have to have a second opinion. If you meet a doctor and you just know that's the right person, fantastic. But even if you like the doctor, you can go get a second opinion. It's not an insult. It's not saying you don't trust that person. It's what people sometimes, oftentimes do. And not everyone does, because it's a lot of work to do it. It's a lot of phone calls, but so be it. It's not, I think that I'd like to tell people that it's a very reasonable thing to do. So for information, I think it can be the amount of information you can find about your diagnosis is really overwhelming. And I think there are a lot of sources out there that are not that, I don't know, accurate, if you will. Numbers, you will see numbers, and those numbers, the important thing for you to know are you're not a number, and those numbers are based on people that were treated years ago, and the treatments now are better than that. So I think it's a little hard to read some of those numbers, but I don't think you should get caught up in the numbers if you can avoid it. Really, things are better now than they were even 5 years ago. So that's something important to recognize. I think I will stop now. I probably have more, but please feel free to ask questions. Thank you.
So thank you so much, Stephanie. That's really helpful, and it's a great basis to start from. So I think we're going to turn it over to Nancy Bourque right now.
Hi, everybody. I'm Nancy Bourque, and I am a senior social worker at the Mount Sinai Chelsea Center. And I love my work. And I work with a lot of gynecological cancer patients, as well as some others. And Dr. Blank clearly, accurately spoke about the shock of hearing a new diagnosis. And it's almost, you know, I've never had cancer, but I've had other health challenges, and it's almost like, and I worked with so many patients, it's almost like suddenly you don't understand English. Like, oh, like as a doctor, you just don't even, you can't even hear the information. It's like a little bit of shock. So I agree that it takes time to process information, and we often talk about the adjustment process that comes with any new diagnosis. So if you think about it, any life stressor, including diagnosis, it takes a while to grapple with it, to accept it, and to move through the different stages with it. And that's true for cancer diagnosis as well. And it's just something to remember, that you're not always going to feel the way you feel at first. And often as people go through all the tests and all the things that's needed for treatment planning, once treatment starts, then people often organize themselves around the treatments, and then things fall a little bit more into a pattern and a flow. But the adjustment process is something that we talk about a lot, and to just give people time to move through all of that, and to give yourselves time. And I think it's not just at first, when you first hear a cancer diagnosis. I think it actually, in my experience, comes with each stage of treatment. You adjust to the idea of a surgery or chemo or radiation, or, you know, you go through that, and at each step, it requires a different adjustment, is my experience anyway. And I'd love to hear what your experiences are after we begin the question and answer, and anything you want to share about that. And I was thinking about that new diagnosis, even in the context of a COVID pandemic. What does that look like, right? Because a lot of people are feeling isolated already, and who can they visit with, and who can they not visit with, and who can, you know, all of the unknowns that the pandemic has added can add an extra layer. And Dr. Blank said that, you know, they're allowing one person to come in with newly diagnosed, but, you know, we used to have volunteers at the center. We don't have those right now. Sometimes family members wait outside. They might escort somebody in, but they don't come into the center, in the infusion suite, things like that, you know, it adds an extra layer of challenge, and we are all getting through it, and we will get through it. But I just wanted to acknowledge that COVID can add that extra layer on top of the normal process. And the other thing is that some people, who do you tell? Right? That's another big thing for people who are dealing with a cancer diagnosis. Some people tell everybody, even the stranger standing behind them in the grocery store, or the cab driver, or the bus driver, anybody they come in contact with, they tell everybody. We've all met those people. And some people don't tell anybody, even their closest family. I once met somebody who didn't tell anybody, even her mother who was living with her. Can you imagine? And it's a very personal decision, but for her, the decision, she said she was like kind of the rock for her family. And she didn't want, a lot of her family was still back in Jamaica, but she said, I don't want to have to handle their reaction to my news. I'm like, I'm coping with what I'm dealing with, and I don't want to hear them. But I think most people find their inner circle of people that they feel comfortable sharing with, but that's just a personal decision. And again, it's a process. As you grapple with it yourself, you'll see who you feel comfortable sharing with. And there are support groups also of people who are not your closest friends that you can also share with, right? That's the benefit of a woman-to-woman program or share, or, the support groups that are there. And also telling work, not telling work. That's the other thing for people who are working. There is an organization called Cancer and Careers, which I think is very helpful for people who are working in terms of how do I navigate this with my boss? How do I navigate if I go back to work and there's a gap in my resume, things like that. It's just good to know that there's resources out there. If I had to give somebody like one piece of advice, it's always make friends with your social workers. And I'm not just saying that because I'm a social worker. And Jillian and Rachel are also coordinators of this program, but trained social workers, because social workers know resources and we know how to, you need it, we'll figure out how to get it for you within our systems. So that's, again, not just because I'm a social worker, but I think we know we have resources. And the other thing is the human mind's tendency to go off into worst case scenarios, right? And I think that, again, that's 100% normal. And as you go through the adjustment process, it's like, how do you, pull that in and help reframe certain things and the mind going off, right? But I have some very simple techniques to help with that. And a lot of people find it helpful. You're welcome to them. I'll give the truncated version here. So I call that the mind's tendency to run off to worst case scenarios. I call that the mind goes off and running, right? The mind just goes off and running into worst case scenarios. And when you're gone, you're just gone. You're in there, you're in the thoughts, what's going to happen, how, playing out all the scenarios. But when you become aware that you're worrying, that's your cue. Like, oops, there I am again, I'm worrying, right? So that's your opportunity right there. That awareness is your opportunity to come back to yourself, to kind of ground yourself in your chair with your feet on the floor or your bed if you're lying down, to come back to your breath and the sensation of your body. Because when you're connected to the sensation of your body, you're here now, you're present in the present moment, you're mindful in this moment. And in this moment, you're okay. Just kind of pull yourself back, because we worry about a lot of things that never happen. So in this, and just remind yourself, okay, there I am worrying. Let me come back to this moment, to this breath. And right now I'm okay. And I just, again, reassuring yourself, I'm going to make the best decisions I can at each step along the way as I need to. Me, my family, my medical team, we're going to get through this one treatment, one day, one process at a time. And we're going to make the best decisions we can as it unfolds. And I just think that being able to work, cognitive behavioral therapy, pulling yourself back and working with your thoughts is a really helpful way to just take it slow, as Dr. Blank was saying, just like take it slow and just be in this moment. Know that you have support around you. And I'll just end with a quote. Mark Twain had a very famous quote, and it said, I've experienced many terrible, terrible things, and some of them have actually happened. Meaning the rest of them were in his fears, his fantasies, like a lot of them never happened. So just kind of being able to slow it down, to work with the mind's tendency to run off. It's normal, but you could still work with it. And just to help provide a little perspective and bring yourself back to the present moment can be helpful. I think that's probably more than 10 minutes, but I'm happy to answer any questions later.
Well, you could go on for many more than 10 minutes, Nancy. Everything you have to say is a pearl of wisdom. So thank you so much for that overview of how to get some psychosocial tools to help with the functioning while receiving and going through this diagnosis. So our third speaker is Tricia Clarke, and we're thrilled to turn over the mic, so to speak, to Tricia to share her experience as a cancer patient, a cancer survivor, a woman-to-woman mentee, and a woman-to-woman mentor. So thank you so much, Tricia.
Sure. Thanks for having me. And as I was listening to Dr. Blank and Nancy, I was thinking what a privilege it is to be in this session tonight. And I don't mean privilege in the sense of lucky you. I just mean that it's so great to hear from these two women who I wish that I had that when I was first diagnosed. So my name is Tricia Clarke. I've been a 10-year survivor. I can't believe that this year will be 11 years. And the first time that I heard the words, you should call my colleague, the oncologist, the fear set in. 10 years ago, when I heard those words, I didn't know what to do with them. I actually had a moment of disassociation where I felt like I knew what the word meant, but all of a sudden I wanted to look up in the dictionary for sure what the word meant, because I sensed what it would mean, and I was afraid. I was diagnosed with the stage 2B, and it was I had both things, fallopian carcinoma and uterine cancer. And being diagnosed with it felt scary. It also felt like I just had a lot of questions about how could this be? What did I do? What didn't I do? What should I do now? I went to the doctor's office alone. Because it was just how I processed. I wanted to be in a space. I don't recommend it. I agree with what Dr. Blank said earlier about going with someone who can listen as you're hearing the information, and who can also say back to you what was said. My treatment was 6 cycles of chemotherapy. And I also had to have surgery for a full hysterectomy. And I was working at the time. So I discovered this in the summer as I was preparing to come off of teaching. And during that summer, I was diagnosed and had the first round of treatment. So one piece, as has been mentioned, is how to navigate going back to work, who to tell, how do I show up, how will I get through this? One of the things that felt as a support to me, it would not necessarily feel like that depending on your work situation or workplace, was I did have to involve my my principal and the director. However, I found that they were very supportive, and the entire school was supportive. And I say the entire school because there was a school meeting where I was invited to share with students, which it was necessary because I looked different, right? They left me in June with my hair and my eyebrows and my eyelashes. And when I came back in the fall, my hair was wrapped and I had on eyebrows that I learned to do, didn't know how to do this before, and to wear eye makeup to mask what was missing. One of the distinct feelings that I had was around what does it feel to be, what does it mean to be a woman? What does it mean to be attractive? What does it mean to look pleasing and to look pleasant? I became very insecure about appearance because, again, as I mentioned, my hair and just what I presented, and part of that had to do with I didn't want the world to know. I wanted to go through this quietly, but it wasn't possible. However, in the spaces that I've shared it, I've received that support. In terms of, just to say a bit about the stages of when you're first diagnosed, and then the next steps and the next steps and the next, what you said, Nancy, about at each time you have new decisions to make, you have to deal with each stage. That's true. And looking back, I would say to be in the moment. It sounds, even as I say it, it sounds like you want to run away from the moment, but it's important, I found, now looking back, to be in the moment where you are listening, because you're being given a lot of information, and you also want to listen to your body and what your body is doing. I went through it, as I always say, plowing through it. I wanted to get through it. I wanted to get to the other side of it. I didn't want to give it too much thought. But looking back, I think it would have been important to just let it happen because it's already happening, and to just let it happen as it's happening. One way that I found was helpful for me in terms of coping was writing. I found that even if it was just a sentence or a paragraph, whatever it was, if I wasn't sharing with someone, writing it down. One example is, I remember writing, I'm not on speaking terms with my body because I don't understand what's happening. It just felt, it felt like I was not in control of what I was experiencing, and I wasn't in control of what I was feeling. However, one of the major shifts for me, one of the things that I experienced that I don't think I could do without, was woman to woman. And I do remember, and I'm not saying this, even as I say it, it sounds like a commercial. I'm saying it genuinely from my heart, that without woman to woman and the structure, I don't think that I would have fared as I did. Because in the hospital, I remember the woman to woman mentor coming around and asking me, just talking really conversationally about, and asking questions, sharing a bit about woman to woman. And my first reaction was, no, I don't need that. I don't need it. Thank you very much. I'm fine. I was quick to push away the support. But and that was part of my denial stage. By the time I went home, and had gone through a couple of days, I called her back to say, yes, I am definitely interested. And I was placed with a mentor who is very dear to my heart. She was available for me. She listened to my questions. She would reach out. She would allow me to share what I was experiencing. And now, as a mentor myself, I find it to be one of the best gifts to give someone, the listening ear, and to be able to share my story. So I'm really grateful to be here today, sharing with you, which is still difficult. It's still difficult to share my story. As I was listening earlier, I felt my heart palpitations, the getting teary-eyed, the remembering the moments. So, but overall, I really am happy to share this time with you, and welcome your questions when we get to that part of the evening.
Thank you so much, Tricia. I think hearing your experience as a patient and as a mentor, and the fact that you were able to share so honestly what it was like for you, especially in physical appearance, which is something that I know a lot of women worry about, but sometimes, feel that they, don't want to complain about when there's so much else going on. I think that's just an invaluable experience.